Curry, and today I will be discussing ethical and policy factors in care coordination. Care coordination is a central part of nursing practice because it ensures patients receive safe, organized, and patient-centered care. Ethical standards, especially the ANAA Code of Ethics, guide nurses in making decisions that support patients' well-being, respect, autonomy, and maintain professional integrity. Ethical practice environments also help nurses communicate effectively, collaborate with colleagues, and uphold responsibilities that support coordinated care. Policy plays a major role as well. The Affordable Care Act includes care delivery provisions that expand access, strengthen safety, and encourage more integrated approaches to care, all of which directly affect how nurses coordinate services for patients. Ethical concerns also arise when public perceptions of nursing are influenced by professional behavior, such as social media conduct, which can impact trust and expectations within coordinated care settings. Together, ethical standards and policy provisions shape how nurses support patients across the continuum of care and ensure coordination remains safe, equitable, and aligned with professional values. Social determinants of health, such as income, race, education, transportation, access, and insurance coverage, directly influence how patients experience coordinated care. Individuals with lower income or limited insurance often face delays in referrals, reduced access to specialty services, and challenges maintaining continuity across providers. These disparities increase the risk of fragmented care and poor outcomes, making coordinated care ethically essential. The ANA Code requires nurses to advocate for equitable access and address barriers that affect autonomy, fairness, and safety. By recognizing how social determinants shape care transitions, nurses can make evidence-based decisions that support vulnerable populations and strengthen the continuum of care. Ethical practice environments are essential for effective care coordination because they create conditions where nurses can uphold professional values, communicate openly, and advocate for patient needs. Stokes emphasizes that organizations have a responsibility to maintain ethical climates that support fairness, respect, and accountability. These environments help nurses navigate complex decisions and reduce ethical conflicts that can arise in coordinated care across multiple providers or settings. Ethical environments also influence public trust and expectations, professional behavior, both inside and outside the workplace. Affects how patients and communities view nursing as a profession. When nurses work in settings that reinforce ethical standards and support the ANA Code, the coordination of care becomes more consistent, transparent, and aligned with patient-centered values. Ethical dilemmas often occur in care coordination when patient needs, organizational policies, and available resources do not align. Nurses may face situations where respecting a patient autonomy conflicts with safety concerns or where fairness in resource allocation becomes difficult. The ANA Code of Ethics help guide nurses through these dilemmas by reinforcing core values such as respect, advocacy, and equitable treatment. Ethical practice environments also play a critical role by supporting transparency, communication, and shared decision-making when dilemmas arise. Professional behavior adds another layer to ethical decision-making. Public trust in nursing can be influenced by how nurses conduct themselves both in clinical settings and in public spaces, including social media. When trust is compromised, ethical expectations become more complex, and coordination of care may be affected. Using the ANA code and organization ethical standards help nurses navigate these challenges and maintain integrity while coordinating care across the continuum. The Affordable Care Act includes care delivery provisions that directly influence how nurses coordinate care. Terry explains that the ACA expands access to essential services, promote preventative care, and encourage integrated team-based approaches. These provisions reduce gaps in coverage and help ensure patients receive consistent support across the continuum of care. By improving access and continuity, the ACA strengthens the foundation needed for effective coordination. The ACA also reinforces ethical obligations within nursing practice. When access improves and barriers decrease, nurses are better able to uphold ethical principles such as fairness, advocacy, and respect for patient autonomy. Ethical practice environments further support these responsibilities by promoting transparency, communication, and accountability in coordinated care. Together, ACA policy and ethical standards help create conditions where coordinated care is safer, more equitable, and more patient-centered. Policy provision influence coordinated care differently at the national, state, and local levels. In Virginia, Medicaid expansion increases access to preventative and primary care, but gaps remain for uninsured adults and families who struggle with eligibility or enrollment barriers. At the local level, in Prince William County, limited public transportation and uneven access to specialty clinics affect how patients move between providers. These variations create ethical challenges related to fairness, advocacy, and equitable treatment. Nurses rely on the ANA code to navigate these differences and maintain professional integrity while coordinating care across settings with unequal resources. Policy provisions such as those in the Affordable Care Act can create ethical challenges when coverage limitations or resource constraints affect patient access. Even with expanded access, differences in state and local implementation may still create barriers that require nurses to balance advocacy, fairness, and patient autonomy. In Prince William County, limited transportation and variable access to specialty services can complicate coordination. Ethical practice environments support nurses through communication, transparency, and shared decision-making, while professional conduct strengthens public trust and promotes equitable, patient-centered care. Public trust is essential to coordinated care, and nurses' professional conduct directly influences that trust. Nurses' behavior in both clinical settings and on social media can shape public confidence in the profession, making it important to uphold the ethical standards outlined in the ANA Code of Ethics. Ethical practice promotes accountability, transparency, and respectful communication. Strengthen trust among patients and healthcare teams. Policies such as the Affordable Care Act also rely on ethical nursing practice to support safe, equitable, and patient-centered coordinated care. Advocacy is a core ethical responsibility in nursing that supports patient-centered coordinated care. The ANA Code of Ethics guides nurses in protecting patient rights, promoting autonomy, and ensuring fair decision-making, while ethical practice environments encourage communication, accountability, and collaboration to address barriers to care. Policies such as the Affordable Care Act also influence advocacy by shaping access to healthcare services, making it essential for nurses to promote equitable care and maintain public trust through professional and ethical practice. This presentation highlighted how ethical standards and policy expectations work together to shape coordinated nursing care. The ANA Code provides a foundation for ethical decision-making, while supportive practice environments strengthen communication, teamwork, and accountability. Policy provision includes those in the ACA influence access and care delivery structures that nurses navigate every day. Professional conduct and public trust reinforce these responsibilities, helping ensure that coordinated